Acabaremos la mañana and we'll end up the morning with a keynote speech, health data for enabling people and personalized medicine. We'll have a European dimension about health data. And this keynote speech will be done by Elina Drakvik. Please, the floor is yours. A specialist for Citra's Health Data 2030 project. Thank you very much, Elina, for being here.
Muchas gracias and buenos dias. Thank you very much, and thank you for inviting me here. It's a great pleasure to be here. Since we spoke last time, I got promoted, so now I'm senior lead at Sitra. And also the project has changed, actually, so now it's data-driven health. But I will be still talking about the similar issues. So about TEHDAS, joint action that Sitra has been coordinating. And I will be then also providing some insights into what we have been doing in Finland and some of the key lessons learned there. I will also give you a short sneak peek to the TEHDAS 2 joint action that Sitra will be also coordinating. It will hopefully start next year, but it's currently being planned. But a few words about myself. So I'm senior lead at Sitra. And my focus area is on promoting secondary use of health data. So all that is related to the development of the EHDS, the European Health Data Space. But I also have another responsibility area, and that is advancing planetary and One Health approach in Sitra and also in Finland, and also in terms of what we could be doing better in Europe as an overall. So having this kind of a broader view on health. And that is also why this picture is one of my favorite pictures, because here it all comes together. So if you look at this, this is from the EU data strategy and the different data spaces there. Health is one of the sector-specific pioneering data spaces, but there are, of course, other data spaces in line as well. So there's one on industrial and manufacturing, agriculture, finance, mobility, Green Deal, energy, public administration, but also on skills. And many of these are, of course, relevant when we think about the health and the factors that are affecting health. Our living environment, our working environment, our lifestyle, what are we exposed to? Is there air pollution? What is the impact of climate change? But also the social aspects, education and skills. We know that social determinants of health are also affecting our health. But what we are focusing today is this health data space. It is estimated that in healthcare sector, only 3% of the data is used for producing actual novel insights, new discoveries, novel interventions and treatments. 3%. So that is really small number. I think we can do better. And we have to do better in order to enable personalized medicine, but also personalized prevention. Because we know that the healthcare costs are rising. We have lack of healthcare workforce, but also aging populations. So we know that we also have to do better in prevention. But it will be interesting to see how all these different data spaces will be developing. The health one is now sort of the pioneering one, and the other data spaces are in the progress of being established. But just to give you also a bit of a picture of the legislative landscape, it looks pretty complex. It's quite a jungle. There are different horizontal legislations, for example, the Artificial Intelligence Act that are currently being negotiated, Digital Services Act, Data Governance Act, but also the Data Act, and then the famous GDPR, which has been said that it is often hampering the sharing of the data because of the different interpretations that the different nations have, that what it actually can be shared and what cannot be shared. But it is hoped that with the EHDS, the European Health Data Space, we will have a more harmonized approach also on the GDPR once the EHDS will be implemented. So that is good news also for the researchers. I'm sure many of you are already very familiar with the EHDS, but just a few words about it. The four key aspects, the key takeaways about the EHDS, that it's really aims to empower the individuals to have better control over their electronic health data. It also provides rules for electronic health record systems, and also provides rules and mechanisms supporting the secondary use of electronic health data. And then it also aims to provide these mandatory cross-border infrastructures for primary and secondary use of health data. So my health data at EU for the primary use, and then my health data at EU for the secondary use. And this is, of course, a distributed infrastructure. So we are not talking about one centralized infrastructure, but distributed infrastructure across the member states, and only the EU core services would be central infrastructure part. So EHDS holds, of course, great potential and great vision. As we heard in the sessions before, big data, it is already there. It is happening, and also real-world data is becoming more and more important. The AI models, the predictive models, they can be really used then for screening, but also coming up better interventions and prevention. But we also know that the data is scattered sometimes. It is a lot scattered. Also, the quality is not sure how to promote the quality of the data. And this was also one of the conclusions from Tehdas project. We need a data quality framework. The EHDS is providing federated solution, so it's not a centralized solution, but there will be also some technical challenges in that relation. But we foresaw also in Tehdas that the technical challenges might not be the biggest one. They can be solved. It is more about the governance and the hiccups with the legislation. So harmonized legislation will be provided from the EHDS, but we have to make sure that it will be also implemented in a harmonized manner. So not like with the GDPR, and then you have 27 different member states having different kind of interpretation, what it actually means. So now we are working, and will be working also in Tehdas 2 about the enabling the harmonized implementation. But it is foreseen that there will be some adjustments needed at the member state level to the existing legislations. The health data access bodies will be, of course, the crucial point for providing the access to data. And it is needed that we will have the permit applications for data access streamlined. So that is also what we will be doing in Tehdas 2 joint action. This has been recognized as a challenge, but we know that it will require work to do this. But at least we have identified what needs to be done. And then if we look at, for example, Finland's example and FinData, it really offers a one-stop shop, one entry point to access the data from the different data sources and the data controllers. But we have also noticed that this can create bottlenecks, waiting times. So we have to be prepared so that if there is a lot of demand for accessing the data, that it really can be also handled. But maybe this is not so essential question for you in Spain because you have here a decentralized system. We have also noticed that the EHDS and the legislation in Finland that we already have in place, it increases the safety and the security aspects through the secure processing environment where the data will be accessed. But we also know that this might be a challenge for some of the member states and some of the actors in this field, the health data access bodies, if they will be doing this, because not all of them have the necessary capacity yet, maybe, in place. So we see a really great need for the capacity building and training needs. But EHDS, it really will democratize health data and the access to data. It will provide extensive access to health data. So no longer sitting on your own data, but you really need to share it. But some say, and some citizens are concerned that this may come with some risks. They are concerned that their personal health data might be leaked. So of course there will be measures in place to address these safety concerns. So a few words about Tehdas. So Tehdas joint action was coordinated by Sitra in 21 and 23. And it really sort of supports the member states and the Commission in promoting and providing concepts and recommendations to support the secondary use of health data and also paving the way for the EHDS. So here are the main pillars. So the legal and governance aspects, data quality, but then also infrastructure and capacity building. And the focus of Tehdas was on the secondary use of health data to enable better policy making, but also boost research and innovation. And all the Tehdas reports, they are available on Tehdas website, so tehdas.eu. We produced 36 reports with a big list of recommendations. So if you are more interested, so we recommend that you take a look at the website there. But what we didn't do in Tehdas, and what is also important to notice, is this capacity building. We see a great need for that. Because with the AI and the digital transformation that is happening in healthcare, there is really a great need for the training and capacity building in various member states. But also, we notice that in Finland, it's a constant process and effort. It's not that it can be done once and then it's handled, but it's really a constant process. Some of the key results from Tehdas' work. So here is the conceptual figure of the EHDS architecture. So the health data at EU, how it is in the EHDS. Tehdas actually came up with the original proposal in December 21. And we know that the Commission proposal for the EHDS came in May 22. So the Tehdas work was sort of used as an inspiration for this EHDS proposal. And as you can see here, it's a bit busy picture, but I will navigate you through it. So on this left-hand side, you have this smaller picture. It is really trying to just simplify what is said in a bigger picture. So we have the data subject there that is connected to the data holder. So the data holder has health data from the health data subject. And the data user is connected through the health data access body. And once the permit is clear, then the data user can access the data in the SPE, in the secure processing environment, that the data holder has before that extracted based on the request from the health data access body. And the NCP2 in country A, that can be same as the health data access body, or it can be also a separate organization. But they are anyway connected, and everything that is happening in the green is part of the same country. Now, in the cross-border situation, this country A is also connected to the EU core platform. And there, in the EU core platform, the country B is also connected. So there happens this cross-border connection. And this is illustrated in the bigger picture here. So the NCP2 and the NCP2 they are all connected to the central platform that is the EU core platform indicated in the EHDS proposal. And then if we look at the Tehdas data life cycle, the part in pink is about the data preparation steps, about the collection, standardization, and publication of the dataset descriptions, publication of the metadata, so that the data can be then discovered on the user side. And as you can see, on the data preparation side, there are these icons about the data holder. So much of the responsibility lies on the data holder to make the data available in such a format that it could be used and have the the data on the data, metadata available so that it can be discovered by the other users. And then on the user side, there is the discovery side, permit application, and once the permit is clear, the data user can use it in a secure processing environment. So the access is granted to the secure processing environment where the analysis is done. And after that, there will be the results and the project finalization and feeding back to the core platform and the NCP2 in a cross-border situation. And one of the key recommendations from Tehdas was that it is very important to include data quality measures as a mandatory part of the data lifecycle, so throughout all these steps. We also did Tehdas sustainability report and work on that. We came up with 5 dimensions of sustainability that are crucial for the implementation of the EHDS. So for the secondary use of health data in EHDS, and we noticed that it's crucial to have this clear legal basis in place, both nationally but also at the European level, and robust governance structure, what also the EHDS board will be then happening at some point. We'll see how that develops. But also crucial is to have this access to data. So having in place this infrastructure with the health data access bodies, but also curated and labeled data. There's actually a new EU project that will be starting in that area. And also digitized health data. Otherwise, we cannot use it. And also, the capacity and competence require specific attention. I already talked about the capacity and competence aspects, but really, this was not in the realms of the Tehdas project, but we noticed that this is such a huge challenge that also we need to raise this issue, and this issue needs to be talked about more. Also, the trust among citizens, professionals and policymakers is key. We often talk about trust in terms of citizens, but it's important to have the trust in place between the different actors and understanding the benefits so that also the professionals know why they are doing it and the policymakers are involved because it matters also how we can advance this agenda. And of course, this is not a surprise, but funding and financing is of course needed both at the member states level to invest into the national systems to make the data available and accessible, but then of course at the EU level to have this role in building this cross-border access to data. We also analyzed the benefits and costs and resource needs. And these are, of course, different for the different actors, for the data holders, data access bodies, and users. What was about quite limiting factor in this analysis that we could only use data from 4 different health data access bodies because they are quite rare still. They are in the process of being established. So we didn't have a lot of information to base this analysis on, but based on this kind of preliminary analysis, we saw this. And also based on that information, we noticed that most of the costs for the data access that are charged by the health data access bodies, they are downstream costs of making the data available by the data holders. And fees for permits and secure processing environment are less significant. But this is only for the situation where these health data access bodies already exist. So this is not related to the building costs of the whole systems. So we have the different key players in the EHDS, the healthcare providers, researchers, policymakers, individuals, citizens, patients, healthcare professionals, industry, and also regulators. What is really remarkable in this is that the EHDS will change the operational environment in a very profound way. So we have to learn what are the expectations from the different stakeholders. What are the incentives that are needed, and what are the implications of the EHDS to the different stakeholders? And that is, of course, key when we are doing this awareness raising, but also raising the understanding what it really means. But moving on now to the sort of other main part of my presentation, so telling you a little bit more about the example of Finland. So Finland has been raised as #1 in the Personalized Health Index. How future-proof is the healthcare system in Finland? And we are #1 compared with the 33 European countries. And where we are doing very well is in terms of health information. We have very extensive registries and data available in a digitized form. We are doing well in terms of the scale-up funding, the funding opportunities, in terms of the new technologies. We are also doing well in terms of the data infrastructures that we have in place. But we are not perfect. We are lacking behind as number 10 in terms of performance in health products and technologies. So we also have something to improve on. But in general, we are doing well because we are still #1, so we are doing something right. So here are the cornerstones for the secondary use in Finland. So we think that the key is, of course, this personal identity code. Each citizen in Finland has this, and it is key for linking this personal information from various registries. We also say that we are actually sitting on a gold mine, because we have these very rich data registries with long time series. And in practice, they cover almost 100% of the Finnish population. There's opt-out principle in secondary use of social and health data. So consent is not required for registry-based research, but consent is required for surveys and also biobank studies. We also have high trust on government and authorities in general. They are transparent in terms of their operation and also in terms of their collaboration. I mean, Finland is a small country. We are only 5 million people. So it's easy also to collaborate in that way. We know that we have to collaborate. There's also high trust in terms of the benefits from research in general, but also in health research. Citizens understand that this really can improve the quality of their lives. This really can enhance the development of novel treatments and drugs and better interventions. And there's also high trust in terms of the security and data protection. And we have in place the legal basis, the Act on Secondary Use of Health and Social Data that came in 2019. So it's not a very old thing, but we have also some learnings from that. And along with this act, this FinData was also established, and it started its work in 2020. So FinData takes care of the permits for the secondary use of social and health data. It does collecting, linking, pseudonymization, and anonymization of data. And it also provides Kapseli, the so-called capsule, a secure processing environment that can be used then for accessing the data and the data analysis there. It also provides help desk services throughout this whole process, guiding the users what they have to do, how they have to do, and also training the data controllers, so the data holders. So what has changed since FinData started? So previously, the data user had to file different applications for each data controller. So if you wanted data from the different sources, you had to apply separately for each data controller. And of course, that can be time-consuming and a bit frustrating also for the researchers to use time for such things and then wait and discuss separately how it could be arranged. But now, there's only one application. And the FinData links and pseudonymizes the data, and then it can be analyzed in a secure processing environment. And we actually have already 9 different audited secure processing environments. So the researcher or the data user can choose which of these secure processing environments fits his or her needs best. And also, the data extraction is done on the data controller level, and they are discussing with FinData based on the needs of the proposal to have the permit in place. Here are the national data controllers listed, just to give you some idea what kind of data is there. So the Finnish Institute for Health and Welfare, THL, they have cancer register, infectious disease register, hospital discharge register, national vaccination register, medical birth register, and also many other specific registers. There's also the Social Insurance Institution of Finland that has data on the prescriptions, but also on social benefits. And the Finnish Digital Agency, they have population level data, data on families, residents, but also building information. And then the Finnish Center for Pensions has data about the benefits and incomes and also diagnosis. And FIMEA also has specific permit register, adverse reaction register, and incidents report register. We also have the Finnish Institute of Occupational Health, that is also authority in Finland. So they have data on the occupational illnesses, exposure measurements, but also patient registered related to occupational diseases. And Statistics of Finland have registers on the cause of death. There are also some other smaller agencies, but this shows the multitude of data that we already have in place in Finland and how it is handled by the data controllers. A little bit about FinData in figures. Since FinData started running, these are the statistics until July 23, so it has handled over 1,000 applications and has made 930 decisions. And 94% of these decisions apply with the individual level data. And 95% of these are used for scientific research. And then if we look at the applicants, 71% comes from the public sector, and 25% of the applicants come from private sector. And always a data utilization plan is required to access the data sets. And for the individual level data, the data can be accessed only for the specific time span. And after that, the data will be deleted. But this is about the distribution of costs. This is a figure from the last year. It also points to the same direction that I told you about the data results in sustainability work, that most of the costs are related to the extraction costs from the data controllers. And these would be in the EHDS term, data holders. And then the data processing and the permit fees from FinData's part, they are really sort of accounting for the minor part of the total costs. So how FinData has then facilitated the use of health data? It really provides a one-stop shop for social and healthcare register data in Finland. So it provides equal and extensive access for all service providers and national data controllers repositories. It has improved data security and data protection of individuals, because FinData is also an independent permit authority. It has to comply with the different rules and regulations, take into account the rights of data subjects, and the data analysis is handled in the secure processing environment. It also offers tools and support for clients and data controllers, so providing guidance, materials, and regulations on data descriptions, but also the helping with the data permit applications. If we look at the EHDS proposal and then the Finnish Act on the secondary use, there are similarities between the two, but there are also some differences. Actually, the Finnish Act has been used as a source of inspiration when drafting the EHDS proposal. So FinData was used as a model also to think about how things could work at the EU level. And the implementation of the EHDS, if we think that we already have in place the legislation, we see that it could be, or it should be, in a way, easier in Finland compared with many other countries who don't have anything like this in place yet. But there are also some key differences when we think about the EHDS proposal and the Finnish Act. So in the EHDS proposal, there are many more data sources listed. So for example, FinData doesn't deal with genomic data, at least not yet. It doesn't also deal with imaging data. So imaging data is not included in FinData, in FinData's processes. And then other difference is that there are more purposes for which electronic health data can be processed for the secondary use. For FinData, it is only research, innovation, policymaking, education, and statistical purposes. But the EHDS is saying more. It also saying personalized healthcare. It is also saying about the AI algorithms. It is also saying about supporting the EU agencies. So it's more extensive. And also, there are more tasks for the health data access bodies compared with FinData, how it is currently having the tasks. Altogether, in the EHDS, there are 20 of them listed under the Article 37. And there are also new duties for the data holders in the EHDS. And the EHDS also brings this cross-border interaction, cross-border access to data. So, here are some of the lessons learned from the Finnish experiences. It really takes time and resources to get the new things running. In terms of FinData, when FinData was established, I talked earlier about the bottleneck. So the waiting time to have access or to get the permit in the first place was in the beginning 14 months. 14 months. That's not how you do research, right? You wait for the data for 14 months. But don't worry, we have improved from that, because in the beginning, of course, it raised a lot of interest. We had this change. Researchers and also the innovators, they were really interested in getting hands on all this data. So they were queuing and filing their applications to have the data permits. And at the same time, FinData was only starting to have the staff in place, to have the processes in place. So they were short of staff. They weren't used to the processes. They were also training the staff at the same time. And at the same time, they had to deal with this flood of applications because of the interest. So our advice is be prepared. Have the staff in place, ready from the beginning, and the trainings carried out, and the processes in place that when it is happening, it is going smoothly. Because surely in the beginning, it will take time to have the learning process and have everything running smoothly. But now that FinData has been operating and running already for 3 years, we can see that the process is actually smoother and faster in terms of the permits, but also collation of the data, so the data extraction from the data holder side. And it also is secure because of the SPEs. But now the waiting time is approximately, it of course depends on the case. There are some more complex cases and some more simple cases. But in terms of the simple cases, the waiting time can be 1 to 2, 3 months. More complex cases, around 4 months, 5 months maybe, in worst cases. So definitely they have improved. But of course, we hear still from the stakeholders, especially from the industry side, that is still taking too long, waiting for the data 4 to 5 months, and the time is money. So it's a constant process of evolving and improving, and we'll see how fast we can get there eventually. But also what has been important is having this clear legal basis in place for the collection of national monitoring data, and this knowledge basis also has become more clear. But we know already, even though we did the legislation change in 2019, or that is when it came to force, of course there was a long process to prepare it, we already know now that the law is outdated in light of the EHDS. We still need to either update the law or then make some other adjustments, because we see that it requires changes in light of the EHDS. Another key learning is that it's really crucial to engage with the stakeholders from the early on and be transparent about it. There was a lot of confusion in terms of the act on the secondary use of health data when it first came. There wasn't communication and awareness raising in the beginning, so you could see sort of different kind of arguments in the media, and then eventually they were not even true. So it was a lot of confusion, so awareness raising and communication engaging is really important. We also see that there's training needs for the data literacy for the healthcare providers to really demonstrate the value of this good quality input data for research. So having the data in place already in the primary side, and then how it can be used for the research and innovation purposes. So having this link, making this link is really important, as well as having in place user-friendly EHR systems. We are not very good at that in Finland, unfortunately. We have noticed that there are low customer satisfaction levels. So the healthcare providers, the healthcare workers, they are struggling with the EHR systems. It is taking too much time from the patient work. It should function in a way that record once, use multiple times. But it's not really happening yet. But we have realized that this is, of course, one of the key issues, and we definitely need to improve here. And also, in that regard, engage with the stakeholders early on, with those who are using the systems, the end users. It's still somehow unbelievable that we still need to be repeating this, but it is often that the end users are forgotten when designing those systems, and that, of course, shouldn't be the case. But I will just briefly tell you a few words about the Tehdas 2 that is in the planning. It is estimated that it will start next year. It's a project, joint action that will run until 26, so it would be a 3-year project. And it is also coordinated by Sitra. So as you can see, it's a busy slide with all the different initiatives and projects that are really related to the secondary use of health data. And as you can see, Tehdas project has ended. It ended in summer this year. And the Tehdas 2 will start probably in June next year, somewhere around halfway next year. We are still in the process of writing the proposal, so nothing is written in the stone yet. And we, of course, need to be looking into what the other projects and initiatives are working on, because Tehdas 2 will be building on also the learnings and results coming from these other projects. So an important project is the Health Data at EU pilot that is working on the concrete case studies. Another important aspect is the direct grants for the member states, because they are forming this so-called community of practice. So it is the health data access bodies who will be then dealing with all these processes and putting in place all these processes in reality. And then, as I said, there has been this capacity building need, and it has been noticed also at the Commission level. There was a tender last fall, and the project will start in the beginning of this year. And also the data quality and utility CSA will start in the beginning of next year. There's also the different infrastructures, so the GDI, Genomic Data Infrastructure Project, a major initiative, also the EMA's EU Darwin initiative, and the EU Cancer Imaging Infrastructure. And of course, in TEHDAS 2, we also need to take into account what is happening in terms of the legislation and where we are going in terms of the legislation. The proposal is being still negotiated. There was a voting in the EU Parliament this week, earlier this week. It was yesterday and the day before. It will still be voted in the full plenary in December, and it is foreseen. The council negotiations are still ongoing, but it looks promising, thanks to the Spanish presidency, that the trilogues would start still in December. And after the trilogue and the sort of agreement between the Commission and the Council and the Parliament, it is foreseen that the final text would be voted in Parliament in April next year, and after that it could be adopted, and then it could be entering into force. And if this time schedule holds, it is expected that the implementation could start from 2026, beginning. We'll see. A lot of some question marks still remain in terms of the negotiations. But here are some of the key elements about TEHDAS 2. I mentioned earlier that the focus really on the harmonized implementation of the EHDS, where we are aiming. So we are producing together with 30 different member states and associated countries these concrete recommendations and guidelines, technical specifications to facilitate this implementation of the EHDS. So working on the data discoverability side, facilitating the discovery and comparability of data sets for the secondary use, but then also advancing understanding of and operationalization of access to health data. So harmonizing, for example, this data access permits so that we don't have 27 different kind of permit applications in different countries, and ensuring secure processing by producing clear and implementable technical specifications for these SPEs, and also facilitating citizen engagement, but also elaborating on the transparency requirements that are in the EHDS. So what is that the health data access bodies need to be doing in terms of the reporting obligations towards natural persons, citizens. And also engaging with the different stakeholders to facilitate this uptake and relevance of results, but also advance this continuity of the different efforts that have been doing in the EHDS implementation and secondary use of health data. So, final words, conclusions. We see that the EHDS really provides a great framework and vision, and having this common vision is, of course, really important. But also, at the same time, having our feet on the ground with the practical implementation and the national roadmaps, how to achieve that, how to make the EHDS reality, and what kind of real concrete actions and efforts will need to take place in order to make that a success. So, thank you for that.
Thank you, Elina, for your so exciting presentation, very clear. I think, I'm sure there will be some questions. I will start with one. No? It was very nice, your presentation about this FIN data effort and the vision of the European health data space and the data strategy. This common vision, we are absolutely agree, no, that is very important. but how you envision the future in terms of maybe differences in different countries? There's maybe a divide. Most of the countries maybe for sure won't be so prepared as Finland, and maybe also Catalonia or Spain, no? And these national roadmaps, no, will have problems for sure. How do you envision these, and how these can be solved over time with this constant, let's say, improvement, evolution and improvement of those roadmaps?
Thank you for this question. I think it's a very relevant question. Well, we see that in terms of the implementation, it will happen not simultaneously for all the countries. I mean, this is a reality. Right now, there's maybe like 4 years' time reserved for the implementation to start. And the member states, they can sort of have a look at their own preparedness level. And according to our current understanding, it is up to the member states to see when they should start the implementation. But there's a specific deadline for that when that at least needs to be done. But there's some room for sort of flexibility that, taking into consideration the different kind of evolution and development in the member states and the situations, because not everybody is that prepared. There has to be this kind of time between to make it happen, yes. And also, there are some discussions in terms of the sort of the granularity and the different expectations that are now laid in terms of the direct grants. The direct grants have been allocated to the different member states to work directly and help prepare setting up these health data access bodies in different countries. So that will also help, as well as the participation in the other initiatives that I showed in one of my slides. That can also sort of build the capacity and see what is happening in the different projects and what is coming out of there, and use that so that you are not trying to invent the wheel all by yourself.
Yeah. Thank you, Elina. So any other question? Monse has a question, please.
Yeah, thank you. Thank you, Elina, because I could say that for me, every single slide that you shared is really valuable, because it has a lot of information, a lot of insights on how to follow also some of the leads, and also helping us understand the details on the governance and how the HDS might work. Still, the conversations are there, as you say, and the decisions have to be adopted. But anyway, this is a clear vision on how it will work. I have some questions. So first, I'd like very much a couple, many, but 2 slides. One is when you talk about the different European the European data spaces. Some of them are more sensible than the others, and for sure health is not one of the fastest ones because it's really sensitive, many of that. So we still are on who's the owner of the data. So this is a clear discussion. It's for me, or for some of the conversations we've held, this is not clear yet. So this is a central aspect of this, because other data are less relevant on that regard. So I would like to hear your insight there. Another thing is, you shared also the slide of the different initiatives about, in the future, in the current. What about EP-PERMED? Because there has some data, a strong data pillar on the personalized medicine partnership. So do you count them on board? Which is the interaction? And the third, and sorry, because I like very much the different work packages of TEDAS2. So how can other organizations be involved on something like that? So
great, thank you. That was many questions. Maybe you can remind me of
I tend to do that, so I can repeat them.
Well, I can start with the last one. How we foresee now in TEDAS2 the stakeholder engagement. There's a dedicated work package for that. We see that there would be national expert groups established in different countries that are participating in TEDAS2. We have been doing that in Finland already for 3 years in the context of the TEDAS project. And it has proved to be a very good concept to involve national level stakeholders, to be transparent about the project, but also ask input from them to our work and then also inform them what is happening in Tehdas 2. So it has been a two-way process, and in that way very helpful. So one forum could be that. Spain has been probably very busy with the presidency, so we'll see what happens there. And then another important forum is, of course, to continue with the stakeholder forums like we had in Tehdas. So we organized these open stakeholder forums for everyone interested to come join, either online or then face-to-face. And definitely we will continue this in Tehdas 2. Another interesting aspect that I didn't say is the compulsory public consultation that will be organized in Tehdas 2. So there it will be public consultation for all the guidelines and technical specifications that will be produced in Tehdas 2. There's a chance to contribute and to be involved. We haven't really decided yet how in practice that will look like, but it's a mandatory part to be done. So definitely we will be informing all the stakeholders whenever we will be having then these kind of public consultations on the different guidelines and specifications. And then in terms of the other question, who owns the data? That's a very interesting question. In Sitra, I work with the fair data economy theme. And the concept in the fair data economy theme is that I, as an individual, I don't really own the data. So the only way to benefit from the use of data is that we don't label it as someone owns it, but we want to share it. And because we share it, there comes the value. So that is the idea. It's a different kind of mindset how we used to think about. It's not like the products. It's not like something tangible, but it's when you share the data, you get the value. And when you share and collaborate with the others in the ecosystem, where everyone brings their own expertise and how they can use the data, the more value we create out of it. That is the idea what we have in Sitra and in the fair data economy. And the third question, you can remind me about that.
Well, I was just curious about the role in EP-Permet inside all that idea.
Yes. It wasn't on the slide because we cannot fit all the different initiatives on one slide. There are many projects, but also in Tehdas 2, how we sort of see the interaction between the different projects. So one of the stakeholder forums could be also dedicated to bringing the different projects together to work on issues where we have similar interests. So that in the Tehdas project, we had dedicated project forums, but we think that it's more effective if we sort of combine this idea. We have the stakeholder forums, and then we have the stakeholder forums that can be targeted to different audiences for projects or for some other forums that are needed for lawyers discussing specific aspects. So that is the idea in Tehdas 2. Thank you for very good questions.
Okay. We can still take another question, if there's any. No? I would like to, is there any? Or not? No. Just the last one, no? But it was, I think, an important statement that you has from the very beginning in the Free and Data project, the integration of social and healthcare data, no? Which is something that is a challenge. Mm-hmm. We are struggling with that here in our community. So that was from the very beginning. There had been any barriers for that? How have you managed this?
Yeah, that's a very good question. I think it also reflects sort of the history, how we have digitalized data in Finland. Because, of course, we started first the digitalization from the healthcare sector. We only thought healthcare data at first. It was only in 2017 that actually the social data started to coming in and also being digitalized. So it has had several years of gap sort of in terms of thinking how the process went in Finland. But I actually don't have statistics that how much of the data that is used by FinData, so how much those two are used together, but it's there, it can be accessed, and we have now also the digitalization of this data in place. But also the picture has been more heterogeneous in this social care data and social data because we have different actors who are taking care of this social welfare system. And that has also complicated the picture a bit and the digitalization process. But now it's mandatory, according to the law, they have to provide this data in the digital form. And that has helped.
Okay, thanks very much, Elina. And well, thank everybody also for staying still here. We are starting now the lunch break, and we'll come back strictly at 3 o'clock for the rest of the session. Thank you very much. Bye-bye.